Fighting sticker shock. People asked to pay hundreds, if not thousands of dollars out of pocket for hospital bills.
In a special investigation, Fox 4 found out many times those bills may be inflated in an effort to get you to pay up. 4 in Your Corner's Lauren Roisla tells you how to check your next bill and keep that price down.
When Michael Rosh's son Julian started complaining of stomach pains, they had no idea it was much more than a simple stomach ache.
You're not thinking about money. That is probably one of the last things.
Michael and his family ended up taking Julian to St. Joseph's Hospital, where they said he needed to have his appendix out. The surgery left Julian with this scar and a story.
$4,300.
But his dad with a shocking discovery.
For $1,000.
How much the hospital charged for some services.
It was just astronomical.
His explanation of benefits shows $46,000 in charges. With Michael's insurance, he owes around $1,100 out of pocket. We had him request an itemized list of costs to see everything he was charged for. Then we compared the family's hospital charges with what Healthcare Blue Book says is fair. That's a nonprofit that calculates fair prices from a nationwide database of medical payment data sorted by zip code. What we found was startling. For IV fluids, the hospital charged $853, but Healthcare Blue Book says a fair price is around $108. For anesthesia, the hospital charges $1,182. Fair price, $51. The hospital also billed more than $1,200 for staples and clips. We went to St. Joe's to ask them about the billing. They weren't able to say much because of patient privacy laws, but told us in part that the amount you actually owe will depend on the benefit plan you have, whether you've met the deductible and your out-of-pocket limit. They recommend asking for a price estimate before a procedure.
It's a cash cow.
But attorneys with Dolman Law in Clearwater say this happens all too often. Any bill can be negotiated, especially for those who don't have insurance.
Can't get blood from a rock. They don't have the ability to pay. How are they going to pay you?
Matthew Dolman says first ask the hospital for an itemized list of charges and compare the fair price for the procedure on a website like Healthcare Blue Book. Then call the hospital.
But negotiate down and then enter into a billing plan.
Michael and Julian are still in the process of negotiating their bill and want to urge others to do the same.
Now, for a complete list on how to review your explanation of benefits, the charges associated with your bill, and a link to the Healthcare Blue Book website that you saw in the story, just head to our site, fox4now.com, and click on this story.
President